I would like to invite the next speaker, Dr. V. Sitalakshmi.
Before that, anyone having questions, we have 2 minutes for question and answers.
Last minute. Good. I would like to invite Dr. V. Sitalakshmi ma'am. She has more than 20 years of experience and in practicing cosmetic and functional gynecology. She's from Hyderabad and she is an established anti-aging specialist and functional gynecologist creating a niche for herself in wellness industry. You are invited, ma'am, please.
Presentation. So thank you, ma'am. Thank you for inviting here and giving me an opportunity to talk about what we are doing in real life situations. I've been a gynecologist hardcore gynecologist for first 15 years. Then I was an assistant to cosmetic surgeon for 5-6 years. Then slowly shifted to aesthetic dermatology, helping the cosmetic surgeon. Then I've seen a great opportunity and lot to talk to people while healing in cosmetic gynecology. Initially, we used to call it cosmetic gynecology, and always assisting labioplasties was very boring. Then, luckily, with the gynecological team, we have been reintroduced to regenerative gynecology, and this is really changing lives. Now, the topic given to me was CO2 laser in clinical practice. So, the disclosures are no financial assistance, and device is depending on the individual selection. It's not coming full control. So CO2 laser is a very versatile laser. It has a wavelength of 10,600 nanometers. It is in the infrared spectrum. It has a high absorption of water. The chromophore is water in the tissue. So it can penetrate from superficial to deep, and depending on how you put the pulse. It has a photothermal effect, that is vaporization of any tissue that it comes in contact, and that leads to coagulation, tissue injury, and it's a controlled thermal damage. Now there are various modes in CO2 laser, that's why it's very versatile. You can use it for cutting and ablation in the ultra pulse mode. You can use it in the fractional mode for a very lot of therapies throughout the body from head to toe. That's why very famous in aesthetic dermatology. Then you have the vaginal handpiece, which is uniquely designed for the vaginal rejuvenation with again the same photothermal ablation. No, so the fractional laser, how it creates the tissue injury and what is the biological rationale. Here, creation of microablative columns of injuries, which are very specific up to the lamina propria, is the most important biological mechanism. The surrounding intact tissue accelerates the healing. There are heat shock proteins that are liberated, and then collagen neosynthesis starts. There is remodeling of extracellular matrix. Now, what are the anatomical changes and why we are using this functional therapy over in menopause? In menopause too, the anatomical changes are thinning and fragility to the vaginal epithelium because of lack of estrogen. There is a reduced lubrication because there are decreased fluids, again influenced by the estrogen lack. There are structural changes. The vaginal canal shortens, it becomes rigid and narrow pipe. Always it is demonstrated with rugosity, and here without rugosity as a rigid pipe. There are mostly vulva changes where the labia minora, the outer and inner lining of Sutik, also flatten and sometimes disappear, not only in volume, even in the size, shape, everything. So, the genitourinary syndrome of menopause is most important thing that we come across every day in our everyday life, and this is where many people suffer. And this genitomenopausal syndrome is not just specific to a few years of menopause, it continues throughout the menopause. That is the reason why the treatments for GSM are very, very important. And then mild stress urinary incontinence. Very few of us still observe it when it is in the SUI. It always comes to us late as a mixed incontinence where some of the treatment fails, and that is why we badmouth the lasers and we badmouth the treatments in gynecology. Regenerative gynecology. Of course, we can use it in vulvar dermatosis just like we use on the skin. There is a labial bleaching and perianal bleaching. This is absolutely a cosmetic indication, more common in the Western societies. Of course, perineal scars of late, I have seen very great difference, and stretch mark reduction, of course, the clients itself are asking for it, and this is again a good indication. Treatment of vulva lesions like anogenital warts, molluscum, skin tags are also neglected in our daily practice, where you can use a CO2 and do it in a very easy way. So, the proposed vaginal tissue effects when we are using in GSM or any other tissues are also in line with the changes that are happening in menopause and the reversal, as Mr. Narendra Malhotra has also indicated. So, there is GSM, there is a vaginal atrophy where it restores the lubrication, elasticity and the epithelial thickness too. Therefore, it's a great measure. Again, we are restoring the vaginal walls. There is dyspareunia, absolutely. Some may talk, but some may not talk. So, there is again reduction in the pain and improvement in the resilience. That way, we are improving the quality of life. The vaginal laxity, of course, many don't complain about it, but they know that they have a feeling that something is falling down, like feeling they have any vaginal laxity in their common terms. So, we can explain and tell them that tightening the vaginal canal can improve the sexual function and improve quality. Recurrent vaginal infection and mild SUI are the absolute indications for CO2, and they do restore the epithelial barrier, improve the vaginal pH, improve the vaginal index, therefore giving a significant improvement for the flora too. Of course, there are no FDA regulations still. We are not very specific about any laser in vaginal. They are approved for their dermatological uses, but not at all approved for vaginal rejuvenation. But there's large studies that are being conducted, and professional bodies recommend its use cautiously. Of course, informed consent and counseling are very essential. We cannot give 100% results, but we can definitely improve the quality of life. This has to be asserted. How the vaginal tightening works? It works. See, you can see in the first pictures how when it is introduced, the rigidity is there in the vaginal canal, and after that, before the CO2, this is. And there are some pictures where 3 fingers we can pass in a vaginal laxity before the laser, and after you can just do the normal physiological 2 fingers. Of course, they come with large cystoceles, neglected sometimes, but still you can give a trial and give them a little comfort and for them till they go to the surgery. This is one of the distressing things that we face every day, but most of the time they come very late. You can see the lichen sclerosis that is generally changing, and there is only a pinhole that is left. The whole anatomy of the labia and the vaginal vulva is distorted. Somehow I feel very distressed when I see this. God has created the beauty even for us in the lower part. So, we have to restore that. Early case, I have seen 1 year back, earliest thing, and within 1.5 years she has come with these changes, completely mutilated labia minora and expanding the lichen sclerosis. So, we can do vaginal warts and with CO2. Very nicely we can actually pinpoint the lasers and give a very, very small scars or no scars at all after healing, and looks aesthetic and comfortable within a few days. So, there is very less pain actually, and there is no, even the erythema they cannot see anyway, so that is not to be a great discomfort. Very rarely burns and scarring occur, and with the newer modalities we never find these things. Training and adherence to the protocol is very, very important. So, CO2 lasers offers precise controllable tissue reaction. It is promising. Evidence is gathering. It is not a replacement for established therapies. You should be ethical, cautious and evidence based. It's safe, and it is always symptom control, and including the vaginal burning also sometimes, and dryness also improves very much. Improvement is simple, was comparable and seen with topical estrogen or any other therapy. So, it is very much useful in GSM and a versatile tool too. Thank you.
Thank you, Dr. Sitalakshmi, for sharing your experience.